This is Manu, Kalia, physical therapist and Ayurveda herbalist. So I'm going to show you a quick test to determine if you have good core and pelvic stability, and to whether you need to work on strengthening your core muscles and then your glutes also, or your pelvic muscles. So this is important not only for day-to-day activities, walking, but definitely for athletes and runners especially, because you want to have good core as well as that pelvic stability, okay? And if that's not there, and often this is the case with a lot of injuries, whether it's low back injuries, hip-related issues, and knee problems. So a lot of stuff is going on further up in the chain in the foundation, as we've talked about before in some of the other videos, that needs to be corrected first. So we're going to work at figuring out if you have good stability at that pelvis, can you maintain the alignment? And if you're not, well, what are the things that are happening, and what do we need to do about it? All right, so this is a simple, it's a bridging test, and we're going to do a single leg bridge. So the first part of the test is going to be just raising up. So as she lifts up there, we want to see, is she able to maintain alignment of the pelvis? Does the pelvis stay level? Or does one side drop down? So if this side drops down, we know some of the muscles are not firing in those glutes. Okay, so that's the big one we want to have in mind. For the specific exercise, we're targeting the glutes. Okay, and if the glutes are not strong, or if there's not enough stability of the core muscles, you're going to have your low back muscles, your rectus spinae, or your hamstrings kicking in to compensate for that movement. So you might feel like some cramping or excessive fatigue in the hamstrings or the low back muscles, because the glutes are weak and they're not able to maintain that alignment. So if I had a dowel or a stick and I placed it, a ruler, I placed it here, this would be nice and level. It would not be tilting to one side or the other. Okay. So what she's going to do is go ahead and come back down. So now when she lifts up this time, so go ahead and raise up. So a little bit lower. So right about there, okay, so that is she's stable. So I have to make sure the glutes are on, so really tighten up the butt muscles, so you're stabilizing, and then she's going to lift one leg up. So we want to make sure she can maintain that alignment, the whole side doesn't dip down when she lifts the leg up. Okay, good, bring it back down. And she's going to always compare and check with the other side. So as she lifts up, same thing. She's really firing these glutes on this side right now to hold that pelvis stable so it doesn't drop down on that left side. Good, go ahead and bring it back down and come back down. So you're checking to see, one, the alignment of the pelvis, does it stay leveled? Second thing is whether your hamstrings start to work more, they start cramping or tightening up, right, getting more strain on them, or your low back, it starts to really feel it, right, where there's a strain or cramping of those muscles, and which means that they're starting to overcompensate and the glutes are not firing to maintain that bridge position. And also not to work at maintaining the alignment of that pelvis. Okay, then if that's the case, then you go back to, you got to work on strengthening the glutes and of course your core muscles too, always, to work on getting that good stability. And that's important, especially when you're walking, single leg activity. You need to have adequate amounts of stability on that pelvis so it does not drop. And when you're walking and running and doing things, because otherwise it'll cause a lot of mechanical problems up and down the chain, causing all sorts of issues for you. So pretty good test, simple test. So test yourself and how long you want to hold it. Let's say work at holding it for 30 seconds to a minute. See if you can do it for a minute. Can you really hold that position? Or do you really start shaking all over the place and you start to cramp in the spots that we mentioned, trying to compensate because you can't hold that position. All right? So test yourself, and if you have weakness, then you go back and you work on those glutes. And I've shown some of the videos, other videos that I did, working on glute strengthening. So you work on those guys and you come back and retest yourself. All right? If you have any questions, leave a comment. Make sure you subscribe to the channel. And go check out my site. I have tons of information on at the site. And we got a pretty cool program coming up on recovery and injuries, specifically for athletes and runners. So stay tuned and keep checking out the videos. I'm going to keep posting information on and how the program's coming up. I think you guys are going to love it. So if you have any questions, leave a comment. Thanks, guys.